shock is referred to as hypoperfusion. Hypoperfusion is inadequate circulation of blood through an organ or a part of the body. Just break that word down: hypo, low, perfusion, blood flow. Hypovolemic shock is a condition in which there is a lot of blood, plasma, or water from the body. There's a loss of a lot of blood, plasma, or water from the body, resulting in an inadequate volume. If fluid in the circulatory system to maintain adequate perfusion, you have to have enough fluid to maintain adequate perfusion. This type of shock may occur because of bleeding, vomiting, diarrhea, burns, among other things. For my firemen out there, just imagine if your supply line got a hole in it. What would happen? Your pressure drops. Your unit is in hypovolemic shock, essentially. Then we go to cardiogenic shock. Cardiogenic shock is a condition in which the heart fails to function effectively as a pump. As a result, the heart does not pump enough blood to maintain adequate perfusion. This type of shock may be due to disease or injury in the conduction system, abnormal heart rhythms, or damage to cardiac muscles. Again, fire guys, if there's something wrong with your engine, for some reason, maybe a knob just won't turn and you cannot get your engine to pump. That would be an example of cardiogenic shock. Next we go to obstructive shock. Obstructive shock occurs when blood flow is slowed or stopped by mechanical or physical obstruction. This type of shock may occur when blood collects in the sac around the heart, preventing efficient cardiac contractions, or when air is present in the chest due to lung injury, putting pressure on the great vessels in the chest and limiting blood flow. Next we have distributive shock. Distributive shock refers to conditions that cause massive dilation of the blood vessels, redistributing the fluid volume within the circulatory system. This type of shock may occur because of massive infection, which is where we get septic shock, severe allergic reaction, which is anaphylaxis, a loss of nervous system control because of neurogenic shock, or psychological causes, such as a psychogenic shock. Conditions that may increase a person's chance of developing disease are called risk factors or predisposing factors. While some risk factors can be changed, others cannot. Examples of risk factors include age, gender, lifestyle, environment, heredity. For example, heart disease. Risk factors for heart disease include obesity, smoking, lack of exercise, unhealthy diet. I've got most of those, so I'm probably not looking too good in a few years. I don't smoke, but I am overweight, and I don't have the best diet in the world. Disease risk factors. Age is an important risk factor associated with the onset and progression of some diseases. For example, the newly born are at risk for disease because their immune systems are not fully developed and able to fight off infection. As we age, our risk of developing conditions such as Alzheimer's, Parkinson's, cancer, stroke, heart disease, and arthritis all increase. Gender. Some diseases are more common in one gender than in others. For example, osteoporosis, multiple sclerosis, breast cancer, rheumatoid arthritis are more common in women. Lung cancer, gout, Parkinson's disease are all more common than men. Lifestyle. An individual's personal habits and lifestyle can increase his or her risk of disease. Constant stress, smoking, excessive alcohol intake, lack of exercise, and poor nutrition are examples or behaviors that can be modified to improve health and decrease the risk of disease. Environment. Some of the most hazardous occupations in our country include logging, mining, farming, fishing, and hunting. The risk of disease or injury in these occupations may be due to a combination of factors, including exposure to pesticides or other chemicals, and safety concerns around machinery. Studies have demonstrated an association between environmental exposure and certain diseases of other health problems. Heredity. Heredity is an important risk factor for some diseases. For example, a family history of heart disease combined with an inactive lifestyle and poor personal habits can greatly increase one's risk of potential heart attack. Causes of disease. Pathogenesis refers to a mechanism by which disease develops. Examples of pathogenesis include infection, inflammation, tumors, tissue breakdown. Etiology means the study of cause. The etiology or cause of many diseases is known. For example, we know that croup, a common childhood respiratory infection, is caused by a virus. The phrase unknown etiology, or idiopathic, is used when the cause of the disease is not known. Signs, symptoms, and syndromes. Some diseases develop in stages. For instance, a disease such as measles may have an incubation period, followed by a period during which signs and symptoms are evident, and the convalescent recovery period. Incubation period refers to the interval between the exposure to a disease-causing agent and the appearance of signs and symptoms. A sign is a medical or trauma condition of the patient that can be seen, heard, smelled, measured, or felt by the examiner. Examples of signs include rash, unusual chest movement, bleeding, swelling, pale skin, and fast pulse. Because signs can be seen, heard, smelled, measured, or felt, they are considered to be objective findings. Some of the ways signs, also called clinical findings, can be determined include physical or psychological examinations, laboratory tests, and imaging studies, such as X-rays. Symptom is a condition described by the patient. Shortness of breath, nausea, abdominal pain, chills, chest pain, and dizziness are examples of symptoms. Symptoms are subjective findings because they are dependent on or subject to the patient's interpretation and description of his complaint. Syndrome refers to a group of signs or symptoms that together are characteristic of a specific disease or disorder. Damage to cells and the subsequent development of disease and injury can be caused by physical agents such as mechanical forces, extremes of temperature, electrical forces, and radiation exposure. Injury due to mechanical forces occurs when the body impacts another object, as in a motor vehicle crash, fall, or physical abuse. These types of injuries can cause mechanical damage such as tearing of tissue, breaking of bones, and injuring blood vessels. Impaired blood flow because of injury to the cells will affect cell metabolism. Extremes of temperature can cause cellular injury. Exposure to cold causes vasoconstriction, decrease in blood flow. Depending on the degree and duration of cold exposure, this may lead to tissue hypoxia and possibly tissue and organ death. Exposure to heat and cold can result in burns depending on the nature and intensity and extent of the heat source. Excessive heat causes cell injury by disrupting cell membranes, injuring vessels, and altering cell metabolism. In addition to tissue damage, electrical injuries can disrupt the conduction of impulses in the heart and nervous system. Remember, the heart has a conduction system. Their electrical system is a conduction system. And in the nervous system, all of the communication is done through electrical pathways. Exposure to radiation can cause cell damage. Non-ionizing radiation, which includes infrared light, ultrasound, microwave, and laser technology, can cause thermal injury. Ionizing radiation, which includes X-rays and radiation therapy used in cancer treatment, can damage cells by interfering with their blood supply or directly interfering with the structure and DNA of the cell. Chemical agents or irritants can injure the cell membrane and other cell structures or produce free radicals that continue to damage cell components. Examples of chemical agents include poisons, air and water pollutants, heavy metals such as lead, carbon monoxide, ethanol, preservatives, and social or street drugs such as marijuana, cocaine, heroin, LSD, the list goes on. Inflammation is a tissue reaction to disease, injury, irritation, or infection. It's characterized by pain, heat, redness, swelling, and sometimes loss of function. An infection results when the body is invaded by pathogens, which are germs capable of producing disease, such as bacteria or viruses. When a pathogen grows and multiplies in the body, its ability to cause disease depends on its ability to invade and destroy cells and produce substances that are toxic in the body. Immune system disorders include allergies, autoimmune disorders, and immunodeficiencies. An antigen is any substance that is foreign to an individual and causes antibody production. When the body's immune system detects an antigen, white blood cells responding by producing antibodies specific to the antigen. An antibody is a substance produced by white blood cells to defend the body against bacteria, viruses, or other antigens. When an antigen causes signs and symptoms of an allergic reaction, the antigen is called an allergen. When an allergic reaction is severe and affects multiple body systems, it's called anaphylaxis. And anaphylaxis is a life-threatening emergency. Autoimmune disorders result when hyperactive immune systems attack its own normal tissues as if it were foreign organisms. Rheumatoid arthritis is an example of a common autoimmune disease. Immunodeficiencies occur when the immune system is unable to defend the body against disease because of a decrease or absence of white blood cells. Patients who have immunodeficiency disorders usually have recurring infections. Immunodeficiencies may be caused by genetic disease, medications, chemotherapy, radiation, or an infection such as acquired immune deficiency syndrome AIDS. That is caused by the human immunodeficiency virus, HIV. Heredity plays a role in some diseases. A congenital disease or condition that is present at birth. Some congenital conditions are obvious at the time of birth, whereas others may not show signs or symptoms until later in life. Examples of congenital conditions include dwarfism, epilepsy, muscular dystrophy, sickle cell anemia, and Down syndrome. Some congenital conditions, although present at birth, are not inherited. Cerebral palsy is a condition associated with a difficult delivery. Proper nutrition is essential to good health. Diet lacking essential nutrients can affect the body's ability to break down, absorb, or use food. Being overweight or obese increases the risk of many diseases and health conditions, including hypertension, high blood pressure, diabetes, osteoarthritis, heart disease, stroke, gallbladder disease, respiratory problems, and some cancers. Well, you have concluded the final chapter of the final section of pathophysiology, Pathophysiology Section 3, and this has concluded all of your lectures for week 3.